I said I would do some videos around the panelectomy that I had, and life got in the way and I didn't do any. I have not been keeping up my end of the YouTube video bargain, folks, so I apologize for that. So I have recently, so it is, what is the date right now? May 17th, I believe. April 4th, I had a fleur-de-lis panelectomy. That is the removal of my excess belly skin. Luckily for me, when I was overweight, I carried out most of my weight on my belly, and so when I lost it, my legs and arms, although carrying a little bit of extra skin, are not aggressive in any way that I would take procedures to fix that. Everything that was excess was around my belly, and that is taken care of by one procedure. So the panelectomy is not a tummy tuck. They don't do any liposuction. The reason I had this done is because this procedure is covered by the provincial healthcare system in which I'm covered by. Excess skin can result in infections and rashes and things when it gets to be too much. So the fleur-de-lis cut is like an upside down T. So you have a abdominal cut from just below your breasts and all the way down to just above your pubic bone, and then you also have a horizontal cut from hip to hip. So it's an upside down T. They took off about 3 kilograms worth of excess skin, which is around about 7 pounds. Here it is set to be a day surgery, which is real aggressive considering such large incisions. They keep you if there are complications, and in my case there were. I had a small internal bleed, and this resulted in me passing out every time I stood up. I was admitted to the hospital, and it took a couple of days before they decided that it was I was losing blood, which was causing my issues. They luckily did not have to go in and find the bleed and fix it. That particular portion resolved itself, but the damage was already done. I had lost a lot of blood, and I had to get replenished. So on day 3, I had 2 pints of blood transfusion, and then by day 4, I was able to go home. The good thing about that is, had this been a day surgery, I would have been sent home with some piddly, Tylenol ones or acetaminophen with a little bit of codeine in it to help with pain. And the pain would have been real aggressive. But because I was still in the hospital, I had a lot of help getting in and out of bed, and I got hospital quality painkillers. So by the time I got home, I had a little bit of discomfort on day 5, for which I took some painkillers for, but other than that, I didn't have a lot of pain. I had more pain with the laparoscopic gastric bypass than I did with this one, and I think it's because the laparoscopic bypass, it cuts through your muscle, and I had to learn how to eat and pain, and I wasn't able to eat a lot, so I was constantly tired. With this one, I didn't have that issue, and it's all skin. It's all skin and fat that they cut into. They didn't have to cut into any muscle. So it was, pain-wise, it was pretty good. You go home with 2 internal drains because they do a lot of washing of the area, and there's a lot of saline and there's a lot of swelling. Additionally, I had, of course, the internal bleed, which had to come out. So you have 2 drains, which are more irritating than painful, and they get removed when you are draining less than something like 30 mils a day or something, or 50 mils a day, 30 mils a day, for 2 consecutive days. So I had 1 drain in for 2 weeks, and I had another drain in for 3 weeks. Once they are removed, it's just numbness, really. You're pretty numb. Your skin is pretty hard. You're swollen. You wear a tight belly binder, which is like, it's like a giant abdominal tensor bandage with Velcro, or like a corset without the sexuality. And that's to keep compression, because you're swollen, and you're swollen for a while, but also to make sure that nothing shifts around, and because they're moving tissue from up here to down here. So yeah, it's a big change in your body. So I have to wear that for 3 months. A lot of people I see that have had this procedure complain about the binder. I actually don't mind it too much, because my belly is very numb and it feels very funny. And when I have the binder on, I know that there is a reason for it feeling funny, because I'm wearing a binder. When I have it off, there's no reason, like there's no physical reason for me to feel funny. So I don't know. I don't know if that makes sense to anybody. But with the binder on, it reminds me that there's a reason why my abdomen feels funny. Yeah. That's it. That's it. I might do another video, because I developed a slight complication. But I didn't want to make this one too long. Right now, everything is healing up fairly well. I've had 6 weeks off of work. I was restricted in lifting anything over 10 pounds for the first 6 weeks. But other than that, there's no real restrictions. You get tired fairly easily in the first few weeks. When I would walk my dog at the park, I could only go certain distances before I got real tired. But of all the procedures I've had, this one has been the easiest. Yeah, so now I have a flat belly, and that I've never had before. So I'm pretty excited. I'm pretty pumped about you know, all of the things that I've been through this year and last year, and how far I've come. And perhaps once I, you know, have the binder off and the scars have faded a little bit, I will do another video, and I'll show you what everything looks like. Right now, as you can see, I am driving. So that is it. That is all. Stay tuned for some more details on my life if you really want to.